Hello everyone, and thank you for joining today's third webinar on integrated care systems, focused on decarbonising the health and care system. My name is Andy Rolfe, and I will be hosting the webinar today. We have an exciting agenda prepared with some excellent speakers who are going to approach today's topic from different angles. We've scheduled 1.5 hours for the whole event. During the first half of the session, we'll have presentations from our panel, which consist of Mark Page. Mark is an Associate Director of Estates and Net Zero at Norfolk and Waveney Integrated Care Board. Ellen Goodwin. Ellen is a Sustainability Manager at Norfolk and Norwich University Hospitals Trust. Victoria Lawson. Victoria is an Executive Director for Environment, Culture and Customer Services at the London Borough of Hounslow. And Tim Samantz. Tim is an Associate Director of Sustainability Growth at Bedfordshire, Luton and Milton Keynes Integrated Care Board. Following the speaker presentations this morning, we have set aside 30 minutes for question and answers from the team. And before we get going, I'd like to briefly hand over to my colleague Rob, who will explain the etiquette for the webinar. Thanks, Rob.
Thanks, Andy. Good morning, everyone. So anyone that's joined our first two webinars will know the format of these. So during speaker presentations, I've already dropped something into the chat. But please feel free to use the chat to post your questions, share your thoughts, and then we'll try to address those once we get to the Q&A. If you see a question that you think is a good one or is a similar one to one that you want to ask, then please like it, give it the thumbs up, so then we can see which ones are most popular come the Q&A. We really want to encourage sort of a very frank and open discussion for you to ask questions to the panel. So while we'll be recording the session for the presentations and then sharing this afterwards, the recording will stop once we get to the Q&A to allow for Chatham House rules. And to ensure for a smooth experience, just to go over a few technical aspects. So if you encounter any technical issues or have trouble hearing or seeing content, then please let us know through the chat box and someone will be on hand to assist you. You'll see that as you've joined now, your microphones are muted. That's just to minimize background noise for the benefit of Andy and the speakers. However, please feel free to leave your cameras on if you want to leave your cameras on. So without further ado, Andy, it's back to you to get us started.
Thanks, Rob. So many of you are probably aware that the UK government has committed to net zero by 2050, and that the NHS has made similar but more ambitious commitments to be net zero by 2045. But why is this important, and why is it important to decarbonise our health and care systems, and how can integrated care systems play their part? Well, healthcare and climate change are inextricably linked. Healthcare is a significant contributor to global greenhouse gas emissions, and the results of climate change are also having a multitude of healthcare-related impacts. It is clear from the last few years that climate change and associated emissions directly impact the health and well-being as a global society. Whether it's through the adverse effects of extreme weather, flooding or extreme heat directly impacting our physical health or our mental health, or the impact of droughts or the loss of habitats has on the supply chains we rely on for healthy food. The impact of climate change is being felt every day. The World Health Organization has recognized that the impact of climate change and unsustainable development will have on healthcare systems. Between 2030 and 2050, the WHO estimates that climate change is expected to cause approximately 250,000 excess deaths, and the direct costs to health are expected to be upwards of $4 billion a year by 2030. They have suggested that climate change has the potential to undo 50 years of progress in healthcare development. Climate change is attributed to causing increased heat, increased disease, poor air quality, and food and nutrition challenges as people adopt processed food due to food scarcity, all of which undermine the many social determinants for good health. These climate-sensitive health risks are disproportionately felt by the vulnerable and disadvantaged and those with underlying health conditions. As a direct impact in the UK, last year saw an estimated 3,000 excess deaths attributed to extreme heat during the summer heatwave. And as a indirect impact, research indicated that nearly 1/5 of hospitals had to cancel elective care operations in the 3 days of the heatwave, with a risk of this raising to 1/3 being cancelled should that heatwave continue. The research also suggested that a third of this was due to operating theatres becoming unsafe due to the environment, the internal environment exceeding temperatures. The NHS has a significant role to play in tackling climate change. The NHS is one of the country's biggest employers and also represents around 5% of the country's carbon footprint. To get to the net zero goal, the NHS needs to remove over 30 megatons of carbon, which is the equivalent to the carbon footprint of Romania. The NHS has set some ambitious goals for decarbonising and setting 2 ambitious targets. To reduce emissions that can be directly controlled by the NHS, energy, waste, gases and fleet travel by 80% by 2032 and net zero by 2040, and to reduce supply chain emissions from medicine and medical equipment by 80% by 2039 and to reach net zero by 2045. Integrated care systems have a vital role to play in supporting these ambitions. The decarbonisation plans set out in an ICS strategy have the ability to consider all aspects of health and social care, working collaboratively across large NHS acute providers, GPs, community health, local councils and community organisations. The ICS can influence across the widest group of stakeholders, leveraging these to reduce carbon emissions while improving health and well-being of local communities. So now over to you, Mark and Ellen, for our first presentation.
Thank you, Andrew. Hopefully you can hear me. Good morning, everyone. I'm Mark Page. I'm the Associate Director for Estates and Net Zero Norfolk and Waveney Integrated Care Board. I'm joined this morning with Ellen to make a presentation on developing an approach to estates decarbonisation. So I wanted to start by focusing on the ICS as a partnership and the ICB as a commissioner. In Norfolk and Waveney, the makeup of our system reflects the way in which funding flows down from national levels. There's an historic divide between the health delivered by the NHS and the social care largely delivered by the county council. Somewhere in the middle, we have a melee of voluntary sector and private sector. The UK government has now defined new structure to population health, ICSs, ICPs, ICBs, and we've seen a change in emphasis whereby the notion of competition has been replaced by collaboration. We've become used to the sense of competing to provide healthcare, and our governance and our systems have grown up to support these notions. But now, how do we just switch to collaborating? We've spent so long on one approach. How do we successfully switch to this new one? The key is perhaps in the title, collaborate, and developing a stronger sense of emphasis on some of the underpinning issues we need to overcome. So looking at leadership, this needs to define and hold the vision, foster innovation through a can-do attitude, adopt self-licensing approaches that lift the lid on constraint. Leaders need to lay the path whilst encouraging the participation, innovation and development of its workforce and organisational partners. Our maturity, organisational boundaries are being tested. Structures are not changing perhaps as fast as the system around them, leading to constraint in outlook and opportunity. Governance and organisational sovereignty defines our processes and responsibilities. Some of our structures are defined nationally and don't change at the same pace as might be expected or anticipated. We have to find new ways of continuing to respect sovereignty, navigating it to achieve consensus-based outcomes, while softly stretching it to enhance our abilities to collaborate whilst competing. Financial structure and flow, money does talk, and often becomes a decisive barrier in the how-to debate. As much as organisational change is required to enable us to fully collaborate, so should our process flows, but it's not as easy as simply making the money flow differently, but needing to align how cost is incurred and funding is directed. Designing how we work is an important factor underpinning collaboration and avoiding the shackles of financial constraint. If we look at ourselves as the ICB as the commissioner, we see that commissioning is changing. Government has required a 30% reduction in the size of all ICBs. This is leading to redefining form and function. Must-dos continue, but other functions are subject to choice. This means the ICB is not the CCG of old. Commissioners have considered function. Examples include convener, collaborator, leader, innovator, and these roles are perhaps less familiar to traditional commissioning roles. And so in essence, the ICB is itself learning about its form and function a year on from its creation. Being an informed client, we may be familiar with the term informed client, but what does it actually mean in the current times? Do ICBs just create a product that improves our population health and leave others to determine how it's best to procure a service? Like a service contract cycle, the task stretches beyond the enabling of the services, their operation, and the change over time. No doubt commissioners already get involved in the deep end of all these stages, but I would argue that collaboration has introduced a strong role in being the informed client, orchestrating the delivery of population health. When we apply this to the decarbonisation of our activities, the role of the ICB as a path builder will see it defining visions, combining resources, convening opportunities, and coordinating innovation in how change can be defined and made a practical reality. Applying these guiding ideas to these early years of our net zero journey has underpinned our approach as an ICS to delivering our decarbonisation programme. In this slide, I've attempted to capture our journey so far. We categorise this in three broad elements to our decarbonisation journey. Firstly, know yourself. In Norfolk and Waveney, we have a 1920 NHS supplied emissions baseline, which we know 10% of our emissions, 470 k's worth, are energy related. We understand that by now we would have expected to make a 15% reduction on this baseline, but like others, we grapple with defining methodology, data sourcing, consistency, and building the measurement and reporting structures around this. Reduction is not linear and is inextricably linked to many factors like investment, governance, and policy. So process has remained at high level, defining the vision whilst developing the here and now through the approach we've adopted. We've painted the backdrop. The ICS defined its vision as establishing ourselves as an enabler of collaboration and sharing of best practice across our member organisations who have decarbonisation fully embedded into their day-to-day operations, empowering a system-wide transition to net zero. The ICS Green Plan is the sum of its provider parts. We assign delivery and ownership to existing subject matter groups where we can, but others we have to develop along bespoke approaches. We defined a 3-year cycle, prioritised our work programme based on leadership consensus, and agreed our key priorities as robust governance, development of internal resource and expertise, development of partnerships, and adoption of best practice. Like others, we have 11 focus areas. The subject diversity creates a huge agenda, making delivery slower in some areas than others, but this breadth of subject provides the best foundation for normalising sustainability and weaving the green thread through our everyday operations. We use an annual operating plan and project programme management principles to define and manage delivery. This has given a semblance of order and ability to deliver across many areas. We use an operational delivery group to combine subject matter leads with project leads, managing progress of our operating plan and reporting to executive sponsors quarterly. We've gone on to extend the reach, closely working with our county council, recently becoming a member of the Norfolk Climate Change Partnership, which has provided synergy with our local authority partners, acting as a sustainability equivalent to one public estate and underpinning the conjoining of partners to the ICS around the net zero agenda. This work is in its infancy, but has mapped common priorities from which further collaboration is beginning to show. We're working through academic links to enhance learning and access to resource to improve our plans. We've developed clinical fellowships for primary care to join up and lead the development of our primary care net zero journey. Worked with SUSTRANS to review and set out action to develop and improve our travel and transport programme. I worked with the Centre for Sustainable Healthcare to define and deliver a programme of carbon literacy training to develop and improve our workforce. We've applied for grants to research and develop our programme for managing our external environments toward nature recovery, in turn supporting improvement towards health, care and well-being. We value the learning collaboration drawn from working with regional colleagues on shared programmes, sharing resource, learning and opportunity to improve this delivery, enabling the NHS to act as an anchor institution in all of its communities. So through this journey and progress I've described so far, that we can see that we're able to begin our carbonisation journey, but there's so much more we have to do. And if there's a takeaway from this journey, then I'd like to share some of the benefits we've had so far on the collaboration of this programme. So why collaborate? Well, why not just continue to compete? I'd argue that perhaps previous approaches no longer fit the mould. We're not best positioned to give the best we can to our populations within our available resources. We're wasting resource in repetition, failing to share innovation and experience, and we're learning there are alternative ways with arguably greater rewards, and these on screen are just a few. Best practice. All too often we found that expertise lies within pockets across the ICS. No one organisation is best at everything. Collaboration through our workstream has helped draw out learning, create opportunity and deliver outcomes to some of the problems we face. Expertise, the soft benefits can save money by being shared and develop our workforce through learning. Financial, this benefit follows the rationale of scale, brings economy, delivering more for every pound spent. It arguably demonstrates good custody of public funds, returning more towards the front line of healthcare. Standardization brings different efficiencies, but improves the quality of outcome and therefore experience for our patients and staff alike. Innovation, whether this is tapping into the ideas others have deployed before or simply sharing access to the device or approach, each example draws out the fact that collaboration does develop innovation, either through shared expertise, investment, or skill. Governance, through alignment, decision-making can be approved. Common understanding, agreement is perhaps more commonplace and therefore processes become quicker. This could perpetuate the motion, creating the sense of a united approach across subjects and whilst respectfully navigating sovereign governance and priorities. Emissions benefits derive perhaps from indirect, resulting from greater scale of outcome to things like procurement, innovation, investment in technologies, and risk reduction can lead to consequent improvement to patient environment and experience. So as may be seen, these and other benefits do accrue from the collaborative process, and the more we can do this, the greater the achievement may be, and more importantly, the impacts on population health. I'll now hand over to Ellen to tell you about her journey with the Norfolk and Norwich.
Perfect. Thank you, Mark. And one of the things I just want to say, 7 months into my role, I absolutely adore that the NHS has a plan and a way for us to get here, and completely echo everything Mark says about collaboration and the importance of collaboration. I am a firm believer that I don't know everything, and I'm very happy to steal ideas from other people, and very much enjoying getting to know the other people within the ICS and Mark himself. And also a huge thanks to Mott MacDonald for helping set the direction in terms of our green plan. And I'm now going to tell you a little bit more about kind of what we're doing more specifically. So Mark mentioned in his opening gambit about the 1920 carbon footprint, and this graph on the right hand side, the pie chart, demonstrates ours at the Norfolk and Norwich University Hospital Trust. And in terms of the energy, so if you look at that there, it is about 10% of our carbon footprint, but about 15,000 tonnes. So a reasonable chunk of the ICS's, I think it was 45,000 that Mark mentioned. But I've kind of grouped these things together because I think for me personally, it's really useful to think about things in those kinds of contexts. I've also got on the left-hand side a really useful diagram that I find really informative in terms of flowchart. I can't remember where it came from. I think it's from not the net zero building standard, but the other one for a state that we've already got. I can't remember its name. People are smiling. You've seen it. That's fine.
Technical annex.
Is that what it is?
Yeah, I'll put a link in the chat.
Perfect, thank you. It's a really good high-level document and definitely worth a read if you haven't seen it. Just in terms of making sure every kilowatt that we're using in terms of energy counts, making our buildings kind of ready for electric heating, thinking about switching from non-fossil fuels, and then looking at on-site renewables as well. And this has been really informative in my first 7 months, really thinking about what we need to do in terms of energy moving forward. And just on the bottom left-hand side, One of the things that I'm really finding in terms of my collaboration with other colleagues is how important the waste agenda is. And although it's not directly related to the energy element, the new clinical waste strategy certainly has kind of put this front and centre in my thinking moving forward as well, and something that people find really visual and impactful, and something that my colleagues are really keen to kind of drive forward and make a change at. So if you can do the next slide, please. So just in terms of what we're doing more specifically on those kind of built environment elements, in terms of the energy, obviously I've mentioned that sort of flow chart and those kinds of things. We've also got another great piece of work that Mott MacDonald helped us with in terms of the decarbonisation of heat on our estate, and that's really helped us set the agenda in terms of how we move forward in terms of these elements. We're also looking at better data. I'm a big fan of data and analysis, and making sure that you can understand exactly where those kind of impacts can be most felt. Also introducing sort of sub-meterings across the estate to understand where our high energy areas are. Energy efficiency, lots of areas where we're using a lot of energy, but unnecessarily in some cases. So, for example, we're turning theatre ventilation off overnight when we don't need it, or certainly trialling that at the moment. Reducing demand, these are all things that are important alongside, making sure your buildings are better insulated before you sort of start on that heat decarbonisation agenda. And then on-site renewables, it's something we're starting to look at Norfolk and Norwich University Trust, but we're kind of making small progress on that at the moment, and very limited progress on water efficiency, but it's something that the Green Plan said we needed to look at, and it's definitely front and centre on my mind, given obviously everything that's happening in terms of changes. In terms of waste, waste hierarchy, reducing waste, increasing recycling, all the usual things in terms of waste, but that clinical waste strategy, like I say, is really setting the scene in terms of what we want to do. And we're also developing an educational video to help people understand what goes in what bin, because that's something that is still colleagues find quite challenging. So, it's always good to just remember that actually the basics aren't something that we're doing necessarily well. Next slide, please. Really conscious of time, so I'm going to run through this quite quickly. So in terms of sustainable models of care, we're looking at anaesthetic gases. I've got a really amazing clinical lead in Dr. Amy Greengrass, who's helping look at these particular elements because she's an anaesthetist. Inhalers, obviously the NHS agenda sets inhalers as something that we need to be looking at. But we've worked out our carbon footprint individually, and we're updating those kinds of things. It's a relatively small proportion of our footprint, so this is where the ICS is really useful in kind of working out which elements each different partner needs to be thinking about. Also looking at things like medicines, because they're a massive chunk of our carbon footprint. The really carbon intensive medical areas, so diabetes, renal, endoscopy and radiology, all areas we're looking at. We're looking at reusable sharps bins, and then some of the more sort of less obvious things, but social prescribing, digital health and health inequalities, and really thinking about how we can drive down our carbon footprint through better sort of proactive management. I'm going to hand back to Mark because I'm running out of time.
Thank you, Ellen. So just to draw it all together, I just wanted to consider the benefits and experiences we've had, continue to wrestling with some of the key considerations, and we'd leave you to just contemplate a few things on targeted investment. Decision making around what and how we invest should strive to bake in the green option as default choice. How do we link value to environment impact? Better still, value to population health and staff well-being. Do we have the right processes in place and people on the same page? Thinking about renewables, innovation and technology, there's a tremendous focus on energy, procurement and management. BREEAM aspires to deliver net zero estate, but can we afford to adopt it in every investment? Equally, can we afford not to? How will we link our use of NHS land to our use of energy and investment in building technologies, and achievement of net zero will remain critical to our success. We should consider the role of innovation and technologies in our journey, being prepared to change ways we work to better outcomes. In managing demand and increasing efficiency, how should we begin and continue our net zero journey? There's so much change occurring around us, it's a wonder we've time to stop and consider what decarbonisation of the estate is about, let alone doing something impactful about it. but we must continue to meet the demands placed on our changing services and populations whilst forging new efficiencies that support the journey to net zero. And finally, achieving decarbonisation. We've all been on the journey for a while now, but so much of it feels new still. The breadth and depth of sustainability leaves no stone unturned, touching every aspect of everyone's responsibilities at work and in private lives. So how does your organisation define and forge its corporate journey to net zero? How do you and will you support this in your walk of life with commitments should each and every one of us continue to make? I've got on screen, I won't read through all of them because I'm conscious of time, but I wanted to share with you some of our own ingredients for sustained success around patience, resilience, courtesy, respect, conviction, and leadership. Those are some of the qualities that underpin the approach and the journey we've shared with you today. Thank you. Over to you, Andrew.
That's great. Thank you very much, both. Thank you for your really insightful presentation. I'd now like to hand over to Victoria for the next presentation. Thank you.
Hi, it's nice to meet you all. So I'm Victoria Lawson. I'm the Exec Director for Environment, Culture and Customer Services at the London Borough of Hounslow. So I'll be talking to you from a local government perspective, but highlighting hopefully some similarities and some differences that hopefully give you some food for thought and some reflection. So next slide. Next one. So I'll just give you a bit of context about Hounslow first. I'm going to highlight some similarities and differences. It's been really great to hear Mark and Ellen first. I'm also going to give you some examples of some of the place-based delivery, because in local government our emphasis is both on our council direct emissions, but also on our borough emissions and how we're working collaboratively across our borough to reduce emissions more broadly. And I'm going to share something innovative that we're working on in Hounslow that might provoke some thought and reflection. So I've got quite a few slides, so I'm going to canter through them at pace. So Noor, if you're ready. So in local government, we have councillors, they're democratically elected on a mandate. That mandate then gets turned into typically corporate plans. One of the key areas of ambition for Hounslow is around delivering a greener Hounslow. Next slide, Noor. Here we go. And one of the key things for us is how can we deliver net zero by 2030 from our direct emissions. And our corporate plan at the moment focuses on a number of different areas. So how we'll green our borough. So how do we create 45% green? It's also talking about how we generate 25% of our own energy. It talks about reducing the impact of flooding and how we can get our carbon emissions down by 50% by 2026. Next slide. One of the key differences, I think, is in local government, we've been able to create an imperative by declaring a climate emergency. So in June 2019, along with a lot of other local authorities up and down the country, in Hounslow, we declared a climate emergency. And following that, working with our community and with our councillors, we developed a climate emergency action plan. And that's focused on both our direct emissions as an organisation and how we influence a borough-wide reduction. And as a result of that, every year since, we've been producing an annual report for our cabinet and our council on that progress. No, next slide. So it's been really interesting to hear colleagues talk about where their energy is at 10%, I think, of your carbon emission. For our direct emissions in local government and in Hounslow, energy accounts for 90% or higher of our direct council emissions because we operate a lot of buildings. At the moment in Hounslow, we've been able to secure significant funding through the public sector decarbonisation funding to reduce our current council footprint by 10%. We're really proud of that, and that went to our cabinet last week to go through that. But that's required £24 million of investment and plays back to some of the challenges that Mark outlined about the investment required and the scale of investment. Next slide, Noor. We also have to look at it because we're also leaders of our place, and Hounslow's carbon footprint as a place is very split across transport, across domestic, and a range of other sort of commercial reasons why we're seeing carbon emissions within our borough. We've worked out to decarbonise Hounslow as an entire place, it will cost us 5 billion. So just to put that into context, and we've seen an 8% decrease in our carbon footprint for a borough. Next slide. So I'm sharing this because there's some similarities in some of the slides that you've seen and will see, and there's some differences. So like you, we're in the same place looking at energy efficiency, renewable energy, how we electrify our fleet, how we reduce our employee transport emissions, waste management. But for us, it's about waste management within our organisation, but waste management of 100,000 households. It's about culture change and sustainable investment for us. But when we take a step back and think about the borough and how we move 288,000 residents to change their behaviours, it then moves us into a space about how do you retrofit Hounslow's properties, both public sector, social and private. How do we increase sustainable travel? Because transport is one of the most difficult parts to shift in terms of carbon reduction. How do we make our borough more green? How do we encourage our residents to adopt net zero lifestyles? And importantly, how do we stimulate a green economy and thinking about the skills required in the future as an economy for the UK, but also how we might be able to stimulate that in Hounslow. Next slide. So this is where I wanted to talk just briefly about the place-based leadership that local authorities have. So it's about our leadership and collaboration across different institutions and sectors. So working with health colleagues, but also working with businesses, with academics, with the community. And there's lots of overlaps between local government and the ICS, but there's also lots of differences. I think, again, reiterating the point about that opportunity to share and learn beyond our own organisational boundaries. And of course, we operate in a space with a public mandate, and therefore that residents, businesses, communities, neighbourhoods is really always at the forefront of our thinking about how we achieve net zero in local government. And that in itself provides a lot of indirect benefits to some of the other challenges that you might have in health. So when we think about decarbonising, we're thinking about how can we do that to tackle health inequalities? How can we do that to tackle structural inequalities, deprivation, poverty in our different neighbourhoods, and using the lens of achieving net zero as a way of tackling many, many other challenges that some of our neighbourhoods, communities and residents experience. And the big question we're asking ourselves is how do we do that in a way that's investable and affordable to the council and affordable to our residents? So I'm going to give you some examples and I'll canter through those quite quickly. So we've retrofitted in Hounslow over 60 of our council buildings using the public sector decarbonisation scheme. So we've been successful in securing 24 million. Next slide. And a lot of those have gone on our schools as well. We've been working with our residents and across West London, so Hounslow is part of West London, to secure funding to retrofit homes. So we've got a plan and we've undertaken some of this already to retrofit 3,300 homes, but that's secured 45 million. And again, it's showing you the level of investment versus the numbers of things that we're able to do at the same time. Next slide. We're also doing things called school streets. So Vision Zero is one of the Mayor's ambition for London about making sure that nobody is killed or seriously injured on our roads by 2040. And part of that is implementing something called school streets, where you're limiting car access in and around schools at start and finish times to try to reduce the level of air pollution and improve air quality for our children on their way to school. And in Hounslow, we've currently got 27 of those in place. Next slide. We've also been looking at green and blue infrastructure. So how do we increase the number of trees, canopies, woodlands, thinking about biodiversity, and there's a lot that we're doing around habitats. There's a lot of new and emerging legislation that will apply to local government around biodiversity net gain, local recovery, nature strategies, etc., etc. And this is our way to do it, but it's also about how we use that to manage some of the climate adaptation that we're going to need as well, because we need to run at the climate emergency, but we also need to make sure that our communities and our residents are resilient to heat, cold, and to flood. Next slide. So this is something that we're doing that's a little bit different. So recognising it's going to cost us £5 billion to get Hounslow to net zero and decarbonise our neighbourhoods. One of the things that we've been working in local government about is how can you create a place-based approach. So thinking about outside of your own organisational boundaries, how can we scale our investment, how can we improve some of the local economic challenges by creating a system approach to net zero based in a neighbourhood for which you then put an investment model over the top. Sounds simple, but I'll show you some of the concepts that we're working on that we're going to hopefully move into feasibility stage. Next slide, Nor. So what we want to do is create net zero neighbourhoods at scale, because my view is if you work in local government, it's not about who gets there first, it's about making sure everybody gets there and that it's not about who comes last. So what we want to do is think about how can we accelerate that at scale and how do we roll that out across our borough. So we want to take a holistic approach to combining not just retrofit and energy, which you could take to the private sector and they would say that's investable, but how you do that where you're then thinking about trees, flood adaptation, tackling inequalities, skills, green economy, all as a whole. So you're thinking not just about the economics of it, you're thinking about the community and the social benefits and the health benefits all at the same time. And how can we use that to address cost of living pressures, fuel poverty, food poverty, etc., etc. And how do we do that knowing that we've got very, very different sort of building typologies, not just within Hounslow, but across London and across the UK. Next slide, North. So this is just an example, so I'll just share this with you. So this is how it could typically look for a family right now. So you have a family of 4, they've got a semi-detached, it's EPC rated D, household bills are 4,200. If that person is willing and able to, and that's a really important phrase, willing and able to, invest in their house to be retrofitted, it probably costs them around 42k. That's great. They'll be able to retrofit their home. Their EPC rating is now A, and their household bills come down to £1,200 per annum. However, they have to pay that loan back. Let's just say it's £3,000 a year. So in 14 years' time, they'll pay that back and they'll see the benefit of that. Not sure about anyone else on this call, but if I had 14 years to my current age, and I'm really enthusiastic in this space, that is a lot of money to ask. When I mentioned it to my chief executive, he said he might be dead by then. So where's the incentive? So if we flick onto the next slide, what we're saying is there a way to work between the public sector and the private sector to create an investment model so that same principle, but the retrofit is fully funded up front? In addition to that, we can build in other neighbourhood improvements, whether that's green spaces, EV, community facilities. The house still gets completely retrofitted. It still has an EPC rating A, but this is where it gets interesting. So the household bills come down and part of it goes to the resident, the householder. The other part goes into the investor and the lifetime maintenance. So can we get that to work as a proposition? And there's been a outline business case that an organisation called the City's Climate Investment Commission, which represents about 95% of local government, has taken to the Department for Energy Security and Net Zero and said, this is our outline strategic business case. We think we could get this to work. If we can, it'll revolutionise how we can decarbonise at scale in places. Next slide. So we've been trying to take ourselves on that journey in Hounslow about understanding and building up the data that will influence what our neighbourhoods are actually saying to us in their own individual sort of net zero journey, because you have to localise it to about 600 to 1,000 homes. So we've gone through a range of stages, and we're now at sort of feasibility that will be going to our cabinet in the autumn for decision to say, yes, we'll move to the feasibility stage out of concept. So next slide, Nor. So I've got some, I think they're maps just to show you how we've built the data up. So we've looked at deprivation across our borough. So the green is some of our most deprived areas in Hounslow. And we're targeting that specifically because we don't want to just go to the easy parts. We want to go to the areas where it's going to have the most impact. Next slide, Nor. And then on top of that, we've started to outline, well, what's, in addition to deprivation, what's the housing mix? What's the transport mix? What's the green and blue infrastructure? And how do we get this into a short list that's sort of currently circled? Next slide. And then when you take that even more and you start looking at the detail around EPC ratings and tenure, that helps us start to narrow this down. And again, we've started to come up with potential neighbourhoods in Hounslow where we would apply this model. Next slide. But we can't do that without taking our communities with us and our neighbourhoods with us. So we've done some very high level community engagement and thinking about the future of this, it's going to need both that hard and soft engagement, if I describe it in that way. So we're going to need to help our communities reimagine their neighbourhoods, because I think sometimes when we talk about net zero individually, people might see it as a way of like a deficit. It takes something away from them. They can't do something. It's about difference. It's about reimagining our spaces. The other part of it is, should this model continue to demonstrate that it can work, what would enable someone to knock on your front door, tell you that they could retrofit your home, change the fabric of your home, and you allow them through the front door to do that? That's a big question for us, but a really important and powerful one. And we've got to absolutely get that right. And it might not be the local authority that does that. It might be part of how we develop the model, that we have brokers that do that on our behalf. Next slide, no. And again, so this is where we're at in terms of feasibility. So we want to explore the ability of the funding model. We want to really look at the community and resident engagement. If we do this, we need to make sure that the market is ready and the supply chain is capable, because you'd need to do this at a scale that I think isn't quite there yet. If you think about how you could influence skills development in the borough, and we need to continue to do more base work on our footprint and how we then monitor the impact. And I think I'll just leave you with a set of thoughts and reflections. So what opportunities are there to share and collaborate in your place, recognising you've got different skills and expertise in your organisations, but also in some of the other public sector institutions that you work alongside. So how can you use that thinking together? We've done a lot of that in West London. So we've done some joint work together on the ICS Green Plan for North West London. We've shared from local government with our health colleagues things like our low carbon procurement toolkit, our emissions-based framework. We've shared some of our thinking around circular economy, etc., etc. And again, I think for me, it's about what opportunities can you create by coming together. And there's examples nationally with the 3CI, so that's the City's Climate Investment Commission operating for local government. Across London, we've got a set of 7 climate programmes. In West London, we've got our climate officers group coming together, and we're really thinking about how we create that voice for your place and for our residents to see if we can turn the dial on some of this. And we're on our journey, and I'm happy to share anything I've talked about today if colleagues on the call are interested, but I'll leave it there in terms of thoughts and reflections.
Thank you, Victoria. That was extremely insightful. Andy's just messaged that his Teams has gone down, typical with a webinar. So I'm just stepping in. He did have a question for you, Victoria, but I'll get him to hold that until the Q&A. So I'm just going to move us on, if that's okay, to Tim Simantz from BLMK ICB. And I can see you're back, Andy.
Yeah, sorry about that. Yeah, over to Tim. Thank you.
Thank you very much, and some fantastic presentations this morning that I'm hoping that what I will talk about actually adds to and starts to address some of the questions that they pose about how do we build this into what we're working on. So although I've talked about my on my title slide there, Norge, if you could move on, the health impact of green plans, that's because we're talking about a specific piece of work that we've done here in Beds, Luton and Milton Keynes. But really the subtitle to this is how do we make environmental sustainability everybody's business? And you might ask, with 98% of all staff in the healthcare service believing that the health and care system should be acting more sustainably, you might kind of think, well, actually, do we need to ask that question? You know, surely everybody has built it into what they're doing. It's even in our, you know, in the RCP's model for quality now. So actually, is it really something we need to think about? However, if you go on to the next slide, you'll see how these are some of the things that I've heard people say when I've talked to them about sustainability. And you can see it's easy to see it as a bolt-on. You know, who hasn't heard some of these reasons not to do environmental sustainability, if you pardon that phrase? You know, it's too much. I've already got loads on. It's too expensive. I've got the health of my patients to think about. So there's not anything that I can really do on this. I'll think about it later. In fact, you're a sustainability person. You can do it. So I'm sure you've all heard similar sorts of things. And in fact, in those presentations from Mark, Ellen and Victoria, we've seen some of those sort of challenges come through. Next slide, please, Norge. We even see it in the news. We have these emotive headlines that really sort of, you know, touch our heartstrings to say that this is a real problem for us. In fact, those two photos even come from the Bedfordshire system, wildfires from last summer and the floods there in Bedford from a couple of winters ago. And we have these headlines. So why is it that we still have this cognitive dissonance between us thinking we recognise in the climate change and environmental sustainability is a critical thing for us to focus on, but it's not part of my job in the NHS? So next slide, please, Norge. So how is it? Which way is best? How do we catalyse that action, and how do we guide people to be on a more sustainable course? You know, what is it that we need to do to get people there? Next slide. So the role of an ICS actually provides us with that opportunity. It's the Bedfordshire, Luton and Milton Keynes ICS has this ambition as its sort of overarching statement of what we're trying to achieve. So it's increasing that number of years people spend in good health and reduce that inequality gap. And a lot of our thinking is based on this little person here, which represents the wider determinants of health. So socioeconomic factors, the physical environment that people live in, their behaviours of people, and the healthcare that they access and receive. Now, if you click once more, Norge, I like to add in another element to this chart, which is climate and ecosystems. So I build this in when I'm doing my engagement with people and I talk to people about this, because the challenge is how we get people to understand that climate change, environmental degradation is going to impact on those wider determinants. How do you get people to understand that blue arrow and think about, well, actually, it does become relevant to everything they're working on within health, social care, and wider local authority responsibilities. And that became our overarching aim with this piece of work, is to connect the carbon reduction commitments, the green plan that we've got, with the local health outcomes using evidence base. Next slide, please. Just a little bit about the process that was undertaken. So Emily Loud, I have to give a shout out to her because she was absolutely fundamental to this piece of work. She drove it from the start. Public health registrar that took this on as one of her placements. And she went through this process here. So she did an element of actually trying to understand people and the people involved in the system. So that consultation piece of work, talking to stakeholders in the system, doing surveys and interviews to understand what their relationship was with environmental sustainability. She then gathered local data where it was publicly accessible and easily accessible. And where that wasn't accessible, she used national data sets and extrapolated those down to the local system and applied carbon equivalent emissions to that activity to understand what the environmental impact of our system is, and then applied the green plan commitments to that data to say, well, what if we achieved those? What would that look like in terms of our carbon equivalent emissions? Then using the research on the health impact of environmental issues, she linked those through background to the health impacts, and then produced a set of learning and recommendations for the ICS, which I will go into in the next slides. Next slide, George, please. Thank you. So this is just a very brief one-page summary of some of the work that Emily uncovered. That top driver, the force field diagram there, the driving forces and resisting forces, was from those discussions with people, understanding what was driving them, what would drive them towards achieving those green goals. And you can see some of those things in there. And some of those resisting forces, there is more detail behind this in the report itself, but you can start to see some of those elements that came out in some of those quotes I had earlier, in those elements there. She also uncovered that the ICS and the organisations that make it up are contributing to this harm predominantly through commuting, staff commuting, the food that we offer in our sites, and the health and well-being of the staff themselves. And brought that out, distilled that into some figures for the Beds, Luton and Milton Keynes system. So suggesting that approximately 400 deaths, for example, were relating to air pollution in 2022, and some other data that you can see on the screen there. So you can really connect to what we're trying to achieve for our population with what's going on from an environmental point of view. Next slide. Emily drew that a bit further and said, well, what can we do to our green plan to improve that based on the evidence? And I'm not going to go into these in detail, I'm just conscious of the time, but looking at this one for air pollution, for example, looking at the commitments, the evidence base, and what the health issues that we might have, you can see that she said that maybe we need to improve our commitment there for air pollution is to reduce private staff commuting miles by 40%. That will help get us towards reducing the air quality, improving the air quality at our hospital sites. It won't necessarily achieve those WHO limits, but it will help move us towards that and be a specific goal for us to commit to. Next slide. There are gaps in this, and it's not a perfect model. So our green plan mapped to some of the health issues that she identified, but predominantly air pollution, diet and active travel. And some of the data that we had available only allowed us or allowed Emily to do the work on certain elements of those health issues. And in fact, our green plan was not sufficient for us to address certain things such as extreme weather there, because we didn't have at the time an adaptation plan for us to say, well, what would the impact of that adaptation plan look like? So there is work still to do. And that drove Emily to the recommendations on the next slide, which I'm not going to talk through in detail, but really, in essence, we just need to make sure that we're showing we're serious, and we need to respond with the appropriate urgency and make the most of that health opportunity. Next slide. So where has it taken us? What have we done with that? And where has it led us? How is it influencing the work we're doing? Next slide. And it takes us back to that original question. It really is everyone's job. The health impact assessment really helps us demonstrate to people on the ground in our local system that good healthcare is a consequence of environmentally sustainable healthcare. It's not just a bolt-on. It does align to that Centre for Sustainable Healthcare model, but it helped us be able to pick out specific comments, questions, thoughts for people to consider in the work that they were doing. So, is the work that I'm doing on stopping people getting ill or helping people get better quicker, does that contribute to environmental sustainability? Does environmental sustainability contribute to improved health? Is this sort of bi-directional relationship that we've got? And it thinks about short term and the long term, not just a sort of conceptual, planetary health conversation. Next slide. That enabled us to build it fundamentally into our joint forward plan, which all integrated care systems should have. The joint forward plan, so environmental sustainability is the driver for achieving our aim, that aim that I talked about earlier. It's not just something we have to do alongside our goals, it's something that is going to help us achieve them. It's led us to developing more detailed activities that sit underneath our green plan. It's improved the engagement that we do on environmental sustainability, and it's we're starting to see more and more people come forward and talk about how it relates to the work they're doing. I had a conversation exactly on this topic yesterday about the link between a care model and the environmental sustainability and vice versa. And then there's sustainability impact assessment, which is an area where our thinking is developing. And I just want to share with you some early thoughts that we've been having both within Beds, Luton, Milton Keynes and with our colleagues, my peers, such as Mark across the east of England. So on the next slide, Norge. So you're used to thinking about quality and financial and equality impact assessments. We do that all the time in our business cases, and we're starting to see that environmental impact assessment come through. The carbon, what's the carbon impact of what we're doing? What difference is it making in terms of our emissions? And that health impact assessment sits at that, I see it as sitting as that on that boundary between environmental and quality impact. What we're also looking at, next click, George, is the social and economic impact, that impact on wider determinants. So it really thinks about that environmental, social and economic triple bottom line piece, sort of thinking about what is that impact on the population? What's that impact of what we're doing on health? And so when we're thinking about fuel poverty, as Victoria was talking about, improving the fabric of someone's house can contribute to the well-being of the people inside it, and therefore the impact on the health service. But also thinking about the infrastructure, can we help build the infrastructure and the environment so that it encourages more active travel? So there's all sorts of things there that start to interact. And if we can get all of these different elements to link together correctly, next click, then we should hopefully be able to have this holistic value assessment of everything that we do, the things that we decide to do. And that, I think, is an incredibly exciting position to be in and to work towards, understanding that the value of what we do, so it's not just about cost, it's not just about the immediate health benefit as a result of delivering healthcare, but it's all of the benefit to the whole population and focusing on population health and reducing inequalities. And I think that is a piece of work that it might take months or years to achieve, but I think it's well worth working to and comes directly out of this health impact assessment. So final slide with any detail on it is what we're planning to do next, which is fill some of those data gaps, think about the footprinting, trying to apply this impact assessment model to the work that we're doing and integrating it into the transformation work that we're doing so that it becomes second nature to everybody, and then use the findings from the health impact assessment to develop a dashboard and a toolkit so that people can apply this to their own systems. So it's not just Beds, Luton and Milton Keynes piece of work. So last click. Thank you for your attention, and I hope that has been helpful.
Brilliant, thank you very much, Tim. And hopefully everyone agrees, some fantastic presentations there, and I'd really like to thank our 4 guest speakers for providing those. Before we stop the recording and dive into the Q&A, I'd just quite like to hand over to Rob for an update on everyone on our final webinar that will be coming shortly. Over to you, Rob.
Thanks, Andy, and thanks to all the speakers. This says forthcoming webinars. We're now on the 3rd of 4, so there's just one left. Next slide, Norge. Just to update everyone on this. So as you can see, we're on the 3rd of 4, that's highlighted in black. The last and next one in the series on the 11th of October focuses on digital and clinical transformation. That's being chaired by our colleague Paul Grant, who is a doctor and previous clinician in the NHS. The speaker lineup for that includes Steve Peddy from the LGA, who's also worked in NHSX. Sam Shah, who I'm sure a lot of people will know, who is a dentist by trade, but has been Director of Digital Development at NHSX as well. And then Sarah Oost, who is the Director of Digital at Herts and West Essex, ICB. So a nice mixture, as usual, of NHS and local authority speakers. At the next one.